Hello everyone, I am Rahila PP, BSc Zoology, Sir Syed College. Today I am going to take a seminar on the topic Ancylostoma duodenale, which comes under the kingdom Animalia and the phylum Nematoda. Ancylostoma duodenale, commonly known as hookworm. It is the intestinal parasite which lives in the intestine of humans. It causes ancylostomasis or hookworm disease. Adult hookworm has a slender and cylindrical body covered by cuticle. The anterior end of the worm is bent slightly in the same direction of the body curve, resembling a hook. Hence they are called hookworms. Mouth is not at the anterior tip but slightly preterminal and dorsal. The buccal capsule is provided with 6 teeth, 4 hook-like on the ventral surface and had a pair of knob-like on the dorsal surface. With their help, hookworm attaches to the host intestine and punctures the intestinal mucosa and blood vessels. Ancylostoma is dioecious. Its male and female exhibit sexual dimorphism. Male. Male is shorter and stouter than female. At the posterior end, male has a cloacal opening. Male has a trilobed cuticular expansion around the cloacal opening known as copulatory bursa or caudal bursa. Protruding from the cloaca is a pair of long and slender copulatory spicules or pineal setae. Female. Females are longer than males. At the posterior end, female has a anal opening. The posterior end is tapering and possesses no bursa. Posterior end of the female is pointed with a caudal spine. Life cycle. Life cycle is completed in a single host, the man. No other intermediate host is required. Life cycle involves few juvenile stages. The last juvenile worm molts and grows to the adult. The following are the various stages of the life cycle. Stage 1. Passage of eggs from the infected host. The eggs containing segmented oval with 4 blastomeres are passed out in the fecus of human host. Stage 2. Development in soil. Eggs under the favorable conditions hatch to rhabditiform larvae. The rhabditiform larva molts twice on the 3rd and 5th day to develop into filariform larvae, the infective stage of the parasite. Stage 3. Entrance to new host. The 3rd stage larvae cast off their sheath and gain entrance into the body by penetrating the skin through the epidermis to dermis and subcutaneous tissue. Stage 4. Migration. On reaching the subcutaneous tissue, the larvae enters into the lymphatic small vessels. They pass through the lymph vascular system into the venous circulation and carried via the right heart into the pulmonary capillaries. They break the lung capillaries and enter into the alveolar spaces. Then ascend upward the bronchial trees to trachea and larynx, crawl up over the epiglottis to the back of pharynx and ultimately swallowed. During migration or entering the esophagus, the larvae undergoes a third molt to form 4th stage, equipped with a buccal capsule allowing adherence to the gut wall. Stage 5. Localization and laying of egg. The growing larvae settle down in the small intestine, undergo a 4th molt to develop into an adolescent worm. At this stage, the provisional toothless buccal capsule formed is cast off and definitive buccal capsule complete with the teeth is formed. During 4 to 5 weeks, the adult who remain attached to mucosa of the small intestine becomes sexually mature. The fertilized female begin to lay eggs which are excreted out in the fecus. The cycle is thus repeated. The interval between the time of skin infection and the first appearance of eggs in fecus is about 6 weeks. From a simple flowchart, we can understand the life cycle of Ancylostoma. Mode of transmission. Human fecus are the only source of infection. The route of infection transmission. First one, cutaneous route. Penetration of the skin by infective filariform larvae. Second one, oral route. Ingestion of L3 larvae present in the soil occurs less frequency. Larvae in mouth develop directly into adult worm. Third one, transmammary transmission, breastfeeding by mothers to infant. Fourth one, very rarely, transparental transmission. Pathogenicity. The percutaneous penetration of the larvae may cause severe itchings and the formation of vesicular rashes. These rashes burst open, giving chances for bacterial infection and ulceration. This condition is called ground itch or Ancylostoma dermatitis. The puncturing of the pulmonary blood capillaries by the larvae may cause local hemorrhage, bronchitis, and bronchial pneumonia, often accompanied by eosinophilia. Adult hookworm in the intestine may feed on blood and body fluid and cause ancylostomasis or hookworm disease. This is characterized by chronic intestinal bleeding, abnormal fall in the hemoglobin content, severe and progressive iron deficiency anemia, intestinal lesion of ulceration, vomiting, diarrhea, etc. Prophylaxis. Mass treatment of patients or carriers using antihelminthic drugs. Sanitary disposal of human wastes. Avoidance of the practice of defecation in the field. Treatment of the contaminated soil with a common salt. Wearing of chappals while walking. Treatment. Mebendazole is a drug of choice oral 100 mg twice daily for 3 days. Others antiparasitic drugs are pyranthalpamide, albendazole, levamisole. Treatment of iron deficiency anemia with replacement iron therapy. Thank you.